Jane Doe is a Hispanic female with developmental delay, is nonverbal, and has a G-tube placement. She was born without any major complications, but 2 days after she went home, she began having trouble eating and latching. At age 2, she was prescribed medicine, but her diagnosis remained inconclusive.
It was not until age 10 that she was diagnosed with chronic hypotonia and chronic microcephaly due to a mutation in the HNRNPH2 gene that was causing further developmental delays and resulting in her inability to walk, speak, and eat. Dr. Seema Arlalani, a clinical geneticist, played a vital role in diagnosing Jane Doe. Hello, judges. I'm Anakaren Garcia.
And I'm Amaris Ramos. You may be wondering what exactly clinical geneticists does and the vital role they play in the healthcare field. A clinical geneticist analyzes and evaluates diseases and disorders that result from genetic anomalies. Clinical geneticists also collect and analyze DNA samples from patients and family members through DNA mapping and sequencing techniques and biochemical processes. They also work alongside other healthcare workers in order to determine the tests needed to be performed on the patient and a plan of treatment for them.
In order to become a clinical geneticist, approximately 12 years of education and training are needed. They need to earn a bachelor's degree, a doctoral degree, and then proceed with 3 years of residency, 2 of which focus on genetics. Licensure is expected and can be completed through the USMLE or the Complex USA test. Certification is not required but is encouraged.
After schooling and training have been completed, entry-level clinical geneticists are able to find work. Even though schooling requirements are fulfilled, clinical geneticists must also have certain career skills that will allow them to succeed in their job. These include being patient, compassionate, having communication skills, technological skills, critical thinking skills, and being highly observant.
Clinical geneticists usually work in hospitals or university-based medical centers. They may split their time between an office setting or a laboratory. They usually work regular business hours Monday through Friday, but may also be scheduled to longer hours and even weekends to complete experiments and obtain test results.
A commonly used test to test for genetic mutations is DNA mapping. On our board, we have included Jane Doe's HNRNPH2 mutation along with images of its DNA mapping. This particular mutation takes place in an X chromosome in a single base throughout the strand. This mutation coded for an extra cytosine base, creating an entirely different amino acid, making that protein unusable. When comparing the mutated strand to a healthy one, there's only one difference, but that single mistake is responsible for all the health issues that Jane Doe faces today.
The 3D model next to the HNRNPH2 mutation illustrates what a DNA strand looks like. It has a double helix shape which resembles a twisted ladder. The ends of the DNA strands are made of a sugar phosphate backbone, and the inside the rungs are made up of 4 nucleotide bases: adenine, thymine, guanine, and cytosine.
The salary for entry-level clinical geneticists varies at the local, national, and global level. Based on the information and chart provided on the board, the national level ranks the highest at an annual average of $81,213. Experience is a huge factor that affects pay, as those longer in the field usually earn more. Other factors that affect pay are employer, geographic location, amount or quality of works published, additional skills, and board certification.
Being a clinical geneticist has many benefits as well as challenges. One benefit in this career is being able to get to know your patient and their families and developing close relationships with them. Another benefit is getting the satisfaction of being able to figure things out, such as what a certain genetic mutation is, sometimes after many years. This can be accredited to the constantly evolving field of clinical genetics that can offer new solutions that weren't present before.
Along with benefits, being a clinical geneticist has its challenges. In this career, clinical geneticists often have to give bad news to some patients regarding their conditions. Furthermore, because medicine is filled with so many mysteries, clinical geneticists are often baffled by some unknown conditions and cannot offer a diagnosis or treatment to some patients. In addition to this, because the field of genetics is constantly evolving and changing, the amount of literature needed to be read can be overwhelming.
In the future, the demand for clinical geneticists is strong, and the trend is expected to continue as scientific discovery is proceeding at a rapid pace, giving practitioners of clinical genetics more opportunities to diagnose, treat, manage, and prevent genetic conditions.
It is because of the work of clinical geneticists like Dr. Lalani that we chose to explore this career and shed some light on the significant changes they make in families' lives. Both of our cousins live with genetic conditions such as autism and Down syndrome, allowing us to see the effects genetic conditions have on the person and their family. We have first-handedly been able to see the impact that clinical geneticists have on their patients and their families, and we hope that through our presentation you have too. Thank you.